Welcome to Steady Badge's Stories. Before I tell you about the nurse in the blue scrubs and the soldier who hadn't spoken a full sentence in 4 weeks, I need you to do one thing. Hit subscribe, leave a like if you end up feeling something, and drop a comment below telling me where you're listening from. I want to know how far a quiet story travels now. Let me take you to a veterans ward in Ottawa on a Tuesday morning in late October, to the moment someone decided that the newest nurse on the floor was the right person to send in as a joke. They assigned Ava Thornton to room 7, because the charge nurse thought it would humiliate her. That was the honest reason. Not because Ava was the most qualified, not because she had requested the case. Lorraine Pett had been running the veterans ward at Rideau General for 11 years, and she had a particular gift for identifying the nurses she could break early. Ava had been on the ward for 23 days. She was quiet, she was 34, and she wore her dark hair in a short bun that never looked quite deliberate. Her scrubs were the standard issue blue of every other nurse on the floor, but they were always pressed, which somehow made her look more out of place rather than less. Lorraine read the room chart out loud at the nursing station that morning, with the tone people use when they are performing cruelty as professionalism. Room 7, she said, Sergeant Declan Vane, 41, retired Canadian Army. TBI, traumatic aphasia, admitted after a collapse at his discharge appointment. He hasn't cooperated with any assessment in 2 days. Threw a clipboard at the last orderly. A pause. Thornton, he's yours. Dr. Sutton looked up from his tablet. He was the attending physician on the unit, and had the particular confidence of someone who had been right in front of enough people that he had stopped noticing when he was wrong. Manage your expectations, he said. Vane's cognition is likely compromised. The aphasia may be masking global deterioration. I wouldn't invest too much time. A resident named Tyler Foss was already holding his phone slightly off his hip, not raised all the way. He didn't need to. Ava looked at the chart. She read it the way she read everything. Completely, quickly, and with a stillness that people around her kept misreading as blankness. Declan Vane, 14 years of service. 2 tours in Afghanistan, an IED blast in 2019 that left him with moderate TBI and what the discharge paperwork called communication deficits of unclear prognosis. He had been at Rideau General for 6 days. Every nursing note used the same 3 words: uncooperative, agitated, non-compliant. Ava hated those words. In her experience, they meant someone had stopped trying to understand. She picked up the chart and walked toward room 7. Behind her, she heard Lorraine say something she didn't bother to catch. The laughter that followed told her enough. She stopped outside the door and looked through the narrow window. Declan Vane sat upright in the bed with his back against the wall, not resting against the pillow. He had pulled himself up so he could see the entire room. Both windows, the door, the sharps container near the sink. His jaw was set. His hands rested open on his thighs, but his weight was forward, the way a person sits when they expect to need to move quickly. A cracked whiteboard on the overbed table held a dried-out marker beside it. Someone had written in blue, "Do notch without knocking." Beneath that, in a different hand, "Patient cannot communicate reliably." Ava looked at that for a moment. Then she knocked twice on the doorframe, opened it slowly, and walked in with her hands visible. His eyes went to her hands first. She noted that. She filed it away. "My name is Ava," she said. "I'm your nurse today. I won't touch you without asking first." He looked at her the way he had probably looked at the last 4 nurses, flat, waiting for the performance to end. She crossed to the whiteboard, picked up the marker, and wrote her name on the clean half. Then she drew a short line beneath it and held the marker out. He didn't take it, but his eyes moved to the marker and back to her face. She set it down. "You don't have to write anything," she said. "I'm just going to check your vitals. I'll tell you before I do each one. You can stop me any time." She took his blood pressure. She told him she was reaching for his wrist before she touched it. She counted his respirations herself without announcing it, because telling a patient made them change their breathing. 26, too fast, temperature 38.4. When she moved to listen to his lungs, she asked permission first and waited for him to nod. He nodded. Left lung clear, right lower field wrong, not absent, not yet, but wrong enough that she took her time, listened a second time, and then stepped back slowly. His right hand pressed into his lower ribs when he thought she wasn't watching. She said, "Does it hurt there?" He said nothing. She said, "You can use your hands." Something changed in his face, not suspicion exactly, something more like recalibration, alive and watching in a way he hadn't been 30 seconds ago. Then slowly he raised his right hand and touched 2 fingers to his sternum, a gesture. Not ASL, not any standard medical sign, short, precise, deliberate. Field signal, contact right, something pressing, something close. The floor went cold beneath Ava's feet. She answered without thinking. Her own hand rose and formed the response, acknowledged, "I see you." Declan Vane stopped breathing for a full second. His eyes moved from her hands to her face and back again. He signed, "Who?" She should have looked confused. That would have been simpler. Instead, she said, "Ava, that's enough for now." He signed again, half a question, half a test. "JTF2? She looked at him for a long moment. His oxygen had slipped to 91 while they had been talking. She reached past him and adjusted the flow rate without touching his arm. "You need imaging," she said. "Your right lower lung sounds wrong. Your breathing is too fast and you're guarding your ribs. I'm going to speak with Dr. Sutton." He caught her sleeve, barely a grip, deliberate. She stopped. He reached for the whiteboard and wrote 4 words in the careful slanted print of someone who knew their handwriting had changed since the blast. They said it was anxiety. Ava looked at the words. She said they were wrong. For the first time in 6 days, Declan Vane's face did something other than wait. Dr. Sutton arrived at the nursing station, with the energy of someone who had decided the outcome before hearing the facts. "Stress response," he said. "TBI patients often exhibit somatic anxiety, breathing treatment and reassurance." "His right lower breath sounds are diminished," Ava said. "He's febrile, tachycardic, and his oxygen has been trending down for 40 minutes. He needs imaging." "You've been in there for 20 minutes. 23. Sutton turned to look at her with the slow patience of someone explaining something to a child. "You're new here, Thornton. Vane has a history of escalation. You're reading physical symptoms into a behavioral presentation." His hand presses into his lower right ribs every time he shifts weight. That's pain, not anxiety. Tyler Foss almost smiled. Lorraine had gone carefully still near the printer. Sutton handed the chart back. "Breathing treatment, document anxiety response, that's the order." Ava looked at the chart. She looked at the door to room 7, then at Sutton. "Clear," she said. She walked back to Declan. He was still upright, still watching the door. "I know what the order is," she said. "That doesn't mean it's right." He signed, "Dr. Stupid." She almost said something. Instead, she checked his oxygen, 89. She hit the rapid response button herself. Lorraine appeared in the doorway within 30 seconds. "What are you doing?" "His saturation is falling." Dr. Sutton made a clinical decision. "His oxygen is 89. The overhead announcement cut through the ward. "Rapid response, room 7. Rapid response, room 7. Dr. Jennifer Yoon from respiratory arrived first. She was small and fast, and she had the quality of someone who listened before speaking. She pressed her stethoscope to Declan's chest, moved it twice, and her face changed. "Right side's gone offline," she said. Sutton said anxiety can present as. Anxiety doesn't remove breath sounds from one side. Yoon was already calling for portable imaging. The image loaded 40 minutes later. By then Declan's oxygen was at 82, his lips had grayed. He was pressing both hands flat against the mattress, the way a person braces when the room begins to tilt. Ava stood where he could see her face. She signed, "Eyes on me, slow breath, I'm here." Yoon read the result and said 2 words, "Tension pneumothorax." Sutton stared at the image. Something passed across his face, the specific expression of a man who understood he had been wrong in a way that would not be forgotten. "Decompression," Yoon said, "now." Declan caught Ava's wrist. He signed against her palm. "You do it." "Consent given," Ava said. Sutton said, "You are not credentialed to perform that independently." "He is at 82% and falling." She had already opened the procedure kit. "If you touch him without my order, I will end your career in this hospital." Ava looked at him. "He needs decompression in the next 60 seconds or this conversation won't matter." She found the landmark, second intercostal space, mid-clavicular line. She told Declan, "This will hurt." He signed, "Done worse." She drove the catheter in. The hiss of released air was the only sound in the room. Declan pulled in a breath, a real one. The monitor climbed, 82, 87, 91, 94. Yoon said quietly, "Good save." The 2 words landed differently than Ava expected. She looked at the floor for 1 second, not from shame, but because some moments needed a second to settle properly. The administrative conference room smelled like recycled air and institutional carpet. The framed values on the wall read, "Respect, compassion, excellence." Ava always noticed when values needed frames. Mr. Galbraith, the hospital's patient care director, sat at the head of the table. Sutton was to his right. Lorraine sat near the door. Tyler Foss had been asked to attend, and looked as though he regretted agreeing to come. "Nurse Thornton," Galbraith said, "you performed an invasive procedure without physician authorization." "I performed a life-saving intervention with full patient consent, delivered in his primary communication mode." Dr. Sutton had issued a clinical order. Dr. Sutton's clinical order would have resulted in a preventable death. Lorraine exhaled sharply. Tyler looked at the table. Sutton opened a folder. There's another concern. Vane used non-standard hand gestures with you. Several staff found it unusual. He paused. Tyler saw something written on the whiteboard before it was erased. Everyone looked at Tyler. Tyler said quietly, "Kite." The air in the room shifted. Galbraith said, "Is that significant?" Ava said, "It's a word." Sutton said, "It's a call sign." Ava said nothing. Sutton's voice sharpened. "You are a probationary nurse using field signals with a classified special operations veteran, who then identifies you by a call sign from a sealed operation. You understand why this warrants an explanation." Ava looked at him steadily. "I understand why you'd want it to be a concern." The door opened. Dr. Yoon walked in with Declan's updated report, and the expression of someone who had decided to be in the room whether or not she had been invited. "I heard there was a review," she said. She placed the report on the table. Sergeant Vane presented with clinically significant tension pneumothorax. Delay would have caused cardiac arrest within minutes. Thornton's intervention was correct, timely, and appropriate given active patient deterioration. "I'll defend it." Sutton said, "Scope of practice." "Scope doesn't cover watching a patient die while you decide." Nobody answered that. The door opened again. Declan Vane stood in the frame, hospital gown, one hand on the IV pole, an orderly pale-faced behind him. He looked only at Ava. "Translate." She held his gaze for a moment, then she turned to the room. Declan signed slowly and deliberately. "She listened to me. 6 days here, and she was the first person who tried to understand before deciding what I meant. You treated silence like a symptom. She treated it like a language." Ava translated every word. Lorraine looked at the table. Tyler set his phone face down. Declan's eyes went to Sutton. His hands moved again. "You heard fragments and filled in the rest with what was easiest. You managed the inconvenience of me instead of caring for the person. You nearly killed me being certain." Ava translated that too. Then Declan's knees buckled. She caught him before anyone else moved. "Chair," she said. Lorraine moved. Yoon grabbed the IV line. Galbraith stood frozen. They got him into the chair. Ava kept her hands where he could see them. "Breathe, stay with me." He signed, exhausted and small, not going anywhere. "You're not going anywhere if you pull that line out." Even then, something moved at the corner of his mouth. 3 days later, a woman in a Canadian Forces uniform walked onto the ward. Silver at her temples, the particular economy of movement that belonged to people who had spent time in small spaces under pressure. Colonel. Her name tag read I. Marsh. She walked into the administrative conference room where Galbraith was attempting to close out the review, looked at the assembled faces, and placed a folder on the table. "I understand there's a question about the identity of one of your nurses," she said. Galbraith said, "Colonel, this is a private review." It stopped being private when a federal contractor's name appeared in Sergeant Vane's medical file. She opened the folder. His discharge papers were altered. The notation of pre-existing condition on his TBI file was inserted after separation to deny federally mandated care coverage. The signature on the altered document belongs to a medical consultant who also appears in Dr. Sutton's research funding disclosures from 2021. Sutton stood. "That is a serious allegation." "Yes," Marsh said, "it is." She turned to Ava. "Petty Officer First Class Ava Thornton, attached to JTF-2 Medical Support Element, 2016 to 2021. Call sign Kite. Meritorious Service Medal with operational significance and 2 classified commendations still sealed. Medically separated under a protection order after Operation Coldwater." Galbraith stared at Ava, as though he had been looking at a photograph and only now understood it was a mirror. "You're military," he said. "I was." "Why didn't you disclose?" "Because I was asked not to." She looked at Marsh. "And because I came here to be among people who understood silence." Sutton pointed at her. She used unauthorized signals with a classified patient. Marsh looked at him with the calm of someone who had exhausted her patience some time ago. "Dr. Sutton, Sergeant Vane has identified you as one of 3 medical professionals who reviewed and co-signed his altered discharge documentation. Federal investigators are in the building. I'd suggest you stop speaking." Sutton sat down. Lorraine covered her mouth. Tyler Foss looked at his hands. Galbraith said after a long pause, "Mrs. Thornton, this hospital owes you an apology." Ava looked at Declan's empty wheelchair near the door, left there when they'd rolled him back to his room. She looked at Lorraine, sitting very still. At Tyler, the color of old plaster. "No," she said. Galbraith blinked. "Apologies are just words," she said. "I want policy. Every veteran on this ward gets a qualified communication assessment within 24 hours of admission." No patient gets labeled non-compliant until staff document what communication approaches were actually tried. No one records a patient without their explicit consent, and no physician orders sedation as a first response to a communication barrier. Colonel Marsh said, "That's not a bad list." "It's the minimum." Galbraith nodded, written, signed, posted. From the doorway, Declan again, ivy pole in hand, orderly behind him, looking as though she had given up. He held up his whiteboard. "All staff. Mandatory." "He says mandatory ASL training for the full ward staff," Ava translated. "Approved," Galbraith said. Declan signed once more and pointed at Ava. She stared at him. "No." He did it again. "He says it should be taught by me," she told the room. "I'm telling him no." Marsh almost smiled. "That seems like something to settle between yourselves." Weeks later, Lorraine showed up early. She stayed late. She found a retired schoolteacher in room 4 who had been signing since childhood and started sitting with him on her breaks, learning, getting corrected without mercy, coming back the next day. Ava saw her one afternoon in room 2, slowly and badly signing to a young veteran who had been on the ward for 3 weeks without anyone genuinely trying. The veteran signed back. Lorraine's eyes went wide. She looked at Ava. Ava nodded once. Not forgiveness. The beginning of something that might eventually get there. Tyler Foss submitted a written apology. 2 pages. It read like a man who had spent several sleepless nights being honest with himself. Ava read it. She didn't frame it. She didn't throw it away. Sutton's name came off the physician board before the week ended. The federal investigation moved faster than anyone expected, which usually meant the files had been waiting for someone to look. On the morning of Declan's discharge, he stopped his wheelchair at the nursing station. The same station where the assignment had been read out as a joke 23 days earlier. He wrote on the whiteboard and held it up so the whole ward could read. "You thought silence meant he had nothing to say. You thought her quietness made her easy to dismiss. You were wrong both times. The hardest voice to silence is the one that never needed to shout." Ava read it to the ward. Her voice stayed even all the way through. Then Declan set the whiteboard down and spoke. 2 words, rough at the edges, precise in the middle, the clearest thing he had said aloud in months. She listened. The ward was quiet in the way a room goes quiet when something true has been said in it. Colonel Marsh, standing near the elevator, touched 2 fingers to her brow, not a formal salute, just one soldier acknowledging another across a hallway. Ava touched 2 fingers to hers in return. Then she lowered her hand, straightened her badge. It still read Ava Thornton, RN, nothing more, and went to check on her next patient. The badge didn't need anything else. Neither did she.